Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. So I'm going to show you something pretty cool to treat quadriceps tendon or tendonitis issues. And I use this a lot with my patients. And we're going to do some cupping. And cupping is used in traditional Chinese medicine. Acupuncturists use it. And actually it's used with a lot of different systems throughout the world. Very effective for improving circulation to the local tissue. So it opens up and removes blockages, right? Removes stagnation and congestion that's going on in the tissue, as well as promotes circulation to that area. So if you have stagnation and blockages that are removed, and you have better circulation coming to that tissue, it's going to heal better. Second thing it does is the suction that it creates, and it pulls tissues up. It also separates layers. So stretching out tissues, different layers of muscle, fascia, connective tissue get stretched out too. So a great way to get at that quadriceps tendon issue. So this is one more technique that I like to use in my other techniques that I've shown you guys before to get at that issue. So I like to actually use an herbal oil first to kind of massage that tissue first. So I'll usually get right in that area and I'll massage that area, and I've shown some cross-friction massage techniques in the past in some of the other videos, and that's a great way to break down scar tissue and adhesions that form all along that quadriceps tendon. Remember that it sits just above your kneecap, and that's where a lot of times people get these injuries, and if you come down too hard if you're jumping, and runners often get this quadriceps tendon issues due to overuse, or it's an forceful landing on the leg, where it often cause a strain or micro tears, which develop into a tendonitis or tendinosis or irritation of that tendon. So after doing that massage, your cross-friction massage techniques, then I usually, a lot of times, I'll use cupping. So what I'm going to do is, so there's a cupping set. So you have to pick the right size pertaining to the size of your leg and your thigh muscle. So we're going to use place it right above the knee here, and I'm going to suction that straight up. As you can see, it pulls that skin right up. Okay, so I'm doing it in this partially bent position. You can also do the leg straight too. So it works quite well. And if you notice, I'm trying to pull that up, and it doesn't really come off. So I got a pretty good pull on that. Right here's my kneecap. So it's stretching out all those fibers. Now you can leave it there too in static positions, just leave it there for 5 to 10 minutes, and it does this work also. It stretches out all that tissue and opens up things there. But the other thing I like to do sometimes with my patients is I like to put that on, and then I like to have them do some movement, gentle movement through there. Okay, so just back and forth as they're moving while it's maintaining that pull there. Now we're not doing any heavy squatting or loading of that tendon. We're just doing gentle oscillations and movement to see if we can promote circulation there while we're stretching it also and relieving that tension there. So I'll just have them do 15, 20, 30 times, moving back and forth, and then we'll just leave it there for about 5 to 10 minutes to stretch out that tissue. Follow, after you do that, follow with heat. So I always use heat. I don't use ice. My patients put heat there. You can also do a warm water soak with Epsom salt, baking soda, ginger water sometimes. Depending on the condition, I'll use various combinations. So great way to do that. And you can remove the suction by pulling this up. You can see a little bit of that redness there. So you can get some redness in that tissue where you're doing that. Obviously be cautious first time you use that. Don't pull it up too tight, and to make sure that your skin doesn't get is not too sensitive. If you have thin skin, if you're diabetic, and if you have open wounds or a cut, don't do the cupping. First time you're doing it, don't pull it up too tight. Test it out 5 minutes or so, and then see how it does. Like I said, you can have a little bit of redness, and usually some people get more red than others, depending on how the severity of the condition and how much congestion or blockage is going on in that area. And it can last a couple of days sometimes, or even a little bit longer, but it should go away. And so do it every, have a day or two in between your cupping sessions, and then so you can do it every other day or give 2 days, and then do that again for about 5 to 10 minutes. So awesome technique. I love it, and I use it for a lot of my patients, and it works great for these conditions. Runners, I've used it with tons of runners, and it works really well. So if you have any questions, leave a comment, subscribe to the channel, and click on the link below. Thanks.